Hi, it's Dr. Tiffany. The last two vlogs I did were on the topics of trauma, how it impacts the brain, as well as how it impacts our thinking. Today I'm going to talk a little bit about what treatment looks like from the sense of exposure therapy. When we experience a traumatic event, the idea of the trauma just makes us want to push it miles and miles and miles away. We want to avoid it. Naturally, as you can imagine, treatment means addressing the trauma, coming up close and personal with the trauma, addressing the thoughts related to it, and also the actual experience that causes us to feel that sense of hypervigilance, that fight or flight reaction that we don't like to sit with. Our goal as psychotherapists is to bring your traumatic event, or at least the thought of it, from a 10, meaning most emotional distress, all the way down to a 0. How do we do that? Like I had mentioned earlier, exposure therapy is key. The more we think of something over and over again, the more we become desensitized to it. I'm not asking you to relive the trauma in the sense of working through the experience, but rather return to it in your memories. Oftentimes when we return to it in our memories, it is very, very painful to sit with. But I assure you, in time, it will go from a 10 to a 0. I want you to think of the first time you jumped off of a high diving board. It was extremely scary, and you probably stood at the very end of the diving board for a very long period of time, contemplating whether or not you would take the plunge. Probably didn't do that in front of many people. It was probably a very solo event, and maybe one other person was there. And you took the jump, and it was terrifying, and it released a ton of endorphins. In that same way, you take that jump over and over again. The second time, you're not standing there for another minute. The third time, you're there for maybe 10 seconds. The fourth time, so on and so forth, and it gets easier to take the plunge, and less anxiety is involved. I always use this cheesy analogy. I was once in the Air Force. And I am absolutely positively terrified of cockroaches. I hate them. So I always tell my patients, because most of them are military, obviously, I always tell my patients, if my colonel came to me and said, you need to keep this big, fat cockroach in your office, I know it's just unrealistic, I get that, but it's just my analogy. You need to keep this big, fat cockroach in your office because there's nowhere else to keep it, right? Makes no sense, I get it. I would have to smartly salute, say yes ma'am, and carry on. But looking at that cockroach freaks me out. It really triggers my fight or flight reaction. I want to run. So I'd have to kind of sit there, maintain my bearing. I'm sure my feet would be all the way up in my chair. I'd be really distracted when talking to my patients. I wouldn't know really how to interact. I'd be so distracted, entirely consumed by that cockroach's presence. I'd try to do my notes quickly, and I'd scurry out of the room when I'd have to go to the restroom, whatever the situation may be. That's the first day. Nothing really registered with me when my patients were talking to me because that cockroach was there. The second day, it gets a little easier. Maybe my feet finally come off the chair and I can walk more comfortably across the room because I'm recognizing the cockroach isn't going to hurt me, even though it freaks me out and it's absolutely disgusting. But I'm able to better be in tune with my patients, understand, what's going on, what they're saying, do my notes quickly, and kind of scurry in and out of the room. By the third day, it's not so bad. My anxiety is down, my heart rate isn't increased the way it was, I can think more clearly, the cockroach is there, it's not doing any damage to me, and I'm able to talk to my patients and really engage in therapy this time around because I've experienced desensitization. Well, in that same vein, your traumatic event is like that cockroach. It's disgusting to you or horrifying to you. It terrifies you. Obviously you're not going to pick up the cockroach and pet it and play with it, but you're going to confront it. You're going to make sense of it. Not going to take that cockroach home and name it Fido. It's disgusting, right? So that cockroach in that same vein is like your traumatic experience. You want nothing to do with it. But the cockroach doesn't hurt you. At least I don't think so. I have never been bit by a cockroach, nor do I want the opportunity for that. But it doesn't hurt. And it seems very terrifying in the moment, but I assure you with time, you will become desensitized to it. When you confront the trauma, like I said, in time it goes from a 10 to a 0, and I've seen it happen. In that same vein, you're working through those traumatic thoughts and those thoughts that I should have, could have, would have, those real stuck points. And together, by bringing down your units of distress from 10 to 0 and working through those stuck points, you begin to make progress. This is how the brain starts to file everything away. Now it's creating a folder, a template to put the trauma in, making sense of it. It no longer becomes an image that you can't absolutely sit with. It becomes something you can look at, confront, and make peace with. But it takes time. There's all sorts of awesome exposure therapies. You can do it in groups. Most people don't choose to, but it still works. You can write your trauma down over and over again. You can repeat it over and over again. You can do eye movement desensitization and reprocessing, which is also another phenomenal form of PTSD treatment that I encourage you to look up. There's all kinds: prolonged exposure therapy, cognitive processing therapy, you name it. We've got it, and it works, I assure you. The best part about going through treatment for a traumatic event is that at the end of it, you become a more psychologically minded human being. Now, we never return to the same shape. Once expanded to a new horizon, we don't return to that same shape, right? We'll never be the same person that we were prior to the trauma. After therapy, what I like to think is that we get smarter. We add a new facet to our brain. We think in a different way. I find that oftentimes when we're done with PTSD treatment or exposure therapy, we are more compassionate to other people. We see the world from a different perspective, and I think it's a healthy, adaptive perspective that makes us stronger and more resilient human beings. But it's tough to go through, and it's not easy. I always like to have so many analogies that are related to military, but I always think that if you have an IED explosion in front of you and you get hit by the shrapnel, when you stay boots on the ground operational, you're not going to address that shrapnel wound. You might just stick a Band-Aid on it, have the medic wipe some antibiotic medication on it, and move on. You're going to keep moving on even when it hurts, even when you're sleeping and it hurts and it doesn't feel good. You just got to keep moving on, right? But finally, when you get back to garrison, back to our state and country, and you're back with your family, you can finally get treatment for that wound. And treating that wound means lacerating it and exposing it and getting all the pus out, cleaning it up, getting on a real antibiotic treatment, and then finally sewing it. The process of coming back and opening that wound is like readdressing your traumatic event. But we're making it better. Though it hurts in the moment of reopening that incision where you were hurt and cleaning it out, it's going to do better. It's going to heal better in a way that it couldn't before. So we want you to heal. Sometimes it's easier to address the traumatic events in our lives as if they were physical wounds. So many times people don't appreciate the trauma that happens to our minds because we can't see it. But I promise you it does get better, and you will be a more psychologically minded individual. I always tell my patients that they have their honorary doctorate degree and expert in themselves. And I think that's important. We all need to be more self-introspective and be kind and patient with ourselves, especially during the healing process. If you have any questions, comments, or concerns, I know this is one of my longer blogs, and I had some goofy analogies. There I go, being self-deprecating. But nevertheless, I hope in some way it makes sense and may resonate with you. And if you have questions, put them down below. Be good to yourself, be kind to yourself, and most importantly, be patient.